Hello, my name is Tim Russell, and this is my GymMed final project. And the condition I chose is restless legs syndrome. So, just starting off with a little background, um, restless leg syndrome is a common condition of the nervous system, which causes an overwhelming urge to move your legs. It's also known as Willis-Ekbom disease. As many as 1 in 10 people are affected by restless leg syndrome at some point in their life. Women are twice as likely to develop restless leg syndrome than men. It's also more common in middle age, although the symptoms can develop at any age, including childhood. So, symptoms. Restless leg syndrome typically causes an overwhelming urge to move your legs. It also causes an uncomfortable sensation in your legs, which can affect your arms, chest, and face at times. Um, they can range from mild to unbearable and usually worse in the evening. These sensations have been described as tingling, burning, itching, or throbbing by different people, but could vary in how they feel by the person. Also, there are two types of restless leg syndrome. The first is primary. Primary restless leg syndrome makes up the majority of restless leg syndrome cases. In these cases, there is no obvious cause of the syndrome. Some researchers think it may be caused by a problem with a part of the brain called the basal ganglia. This part of the brain uses a neurotransmitter called dopamine to help control muscle activity and movement. If the cells in your basal ganglia becomes damaged, the amount of dopamine in the brain is reduced. This causes muscle spasms and involuntary movement. Also, regarding why your symptoms may be worse in the evening, dopamine levels naturally fall towards the end of the day. Also, research has also identified specific genes related to restless leg syndrome. This means it can run in families. In this case, symptoms usually occur middle age, like I said, before 40, if it's genetic. Now moving on to secondary. Oh, can I go back? Moving on to secondary RLS. Secondary restless leg syndrome occurs as a complication of another health condition. It can also be the result of another health related factor. You can develop secondary restless leg syndrome if you have things such as iron deficiency anemia, chronic kidney disease, diabetes, Parkinson's disease, and even rheumatoid arthritis. Also, if you're pregnant, it's most common once you reach 27 weeks or onward. Next, we have PLMS, which is periodic limb movements in sleep. Uh, 80% of people with RLS have PLMS. If you have PLMS, your leg will jerk or twitch uncontrollably, usually at night while you're asleep. The movements are brief and repetitive and usually occur every 10 to 60 seconds. These involuntary leg movements can also occur when you're awake and resting. PLMS is also a differential diagnosis of RLS. Moving on to the differential diagnosis of RLS, we have akathisia, which is an internal desire to move and mostly associated with neuroleptic medication. We have neuropathy, which is basically sensory disturbance. We have nocturnal leg cramps, which is sudden involuntary muscle contractions, and they're palpable tightening of leg muscles. Lastly, we have myoclonus, which is a quick jerking movement that you can't control. Diagnosing. So, there is no single test for diagnosing RLS. To be diagnosed, your general practitioner usually bases it on symptoms, medical history, family history, physical examinations, and test results. Blood tests will confirm if you have primary or secondary RLS. But honestly, most testing is done to rule out differential diagnosis because they fall so close with the same symptoms. Next, we have pathophysiology. The pathogenesis of restless leg syndrome is not completely known. In idiopathic restless RLS, a dysfunction of the dopaminergic system and iron stores in specific regions in the brain are diminished. With uremic RLS, calcium slash phosphate imbalance, anemia, functional iron deficiency, and subclinical peripheral nerve abnormalities may be involved in the pathophysiology of uremic restless leg syndrome. Next, we're going to move on to treatment and management. So I've separated treatment going by primary and then secondary. For primary RLS, um, the best thing to do is have lifestyle changes. So incorporating good sleeping habits, such as going to sleep on time, being in a good environment, nothing too loud, just a good environment, overall sleeping, being a non-smoker, so not smoking, uh, avoiding alcohol or caffeine or other stimulants, and also daily exercise will help reducing symptoms. Medication wise, um, most doctors either prescribe opioids, muscle relaxants, sleep medicine, or medicines to increase your dopamine levels. For secondary RLS, which, like I said, occurs from the complications of another condition. So basically, if we were to treat the first condition, theoretically, your RLS should resolve itself. If caused by pregnancy, symptoms will usually stop within 4 weeks of giving birth. So if you're pregnant, it's not really a big issue. It usually stops. Moving on to management. So these are just a few things you can do to help ease your pain or symptoms. So baths and massages work. So soaking in a warm bath and massaging your legs will ultimately relax your muscles. Using warm or cool packs, use of heat or cold will lessen the leg sensations. And like I said, going back to good sleep hygiene. So fatigue usually worsens symptoms. So not being fatigued will help with your symptoms. Then, like I said, creating a cool, quiet, comfortable sleeping environment would also help. Lastly, using a foot wrap or vibrating pad also works. And these are just things you can use for symptom relief. One last thing I want to leave with you is that secondary RLS can be treated, while with primary RLS, we can only try to ease the symptoms, and that's all these management techniques are. Moving on to outcomes. The diagnosis and management of restless leg syndrome is complex. The condition can be disabling and is best managed by a team provided by your primary care provider. Also, the primary care provider should emphasize the importance of patient education. So your primary care provider should educate you on the different symptoms, the the exercise you should do, uh, the type of drugs you can take, and the potential adverse effects of those drugs. Also, while many drugs are used to treat this disorder, none have been shown to be superior to other classes or other drugs. Most drugs are not consistent and they aren't efficient either or reliable. To conclude, patients should be educated on the progressive nature of the disease and various non pharmacological treatment modalities to alleviate symptoms. Also, the condition may gradually worsen with age. Lastly, the only complications there really are with this condition is that the quality of life is very disturbed, mostly to disturbed sleep and fatigue. And that is my PowerPoint on restless leg syndrome.